First, a couple more of commit-type questions. If you are confirmed, do you commit that you will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs?
Yes.
And do you commit that you will not impose new grant conditions outside of congressional direction for state, local, or global entities that in any way limits, restricts, or rescinds access to vaccines or vaccine promotion programs?
Yes.
And then this is the nice thing about listening to all of this. Let me ask this. I've been impressed. One, you've handled yourself very well. I've been impressed that on many things you are familiar with recent medical data. But on other things, you haven't been. So let me bring up two things that are very pertinent now. While sitting here, I went up to look at the medical literature on these issues. And here's a title, Why Parents Say No to Having Their Children Vaccinated Against Measles, a systemic review of the social determinants of parental perceptions on MMR vaccine hesitancy. And they found that fear of autism is a major driver for vaccine hesitancy among those with a college education or higher, influenced by internet social media narratives over physician-based vaccine information. I'll go back to something I said earlier. You got to follow it, man. There's a lot of people that look to you for, do I get vaccinated or not? People that I kind of know. But here it says it's not just my anecdote, it's actually out there. But when I raised, and you said, well, if I show you the data, you'll change your, because I asked, will you unequivocally, without qualification, say that measles vaccine does not cause autism? And you said, if I show you the data.
I will publicly apologize
So here's
and say that I was wrong.
Here's a meta-analysis from 2014, and you quoted Cochrane on several occasions, which for the people watching is a meta-analysis. A meta meaning they look at everything and then they come to a conclusion based upon as much facts as they can get. And here is such a study, and the title tells it all. Vaccines are not associated with autism, an evidence-based meta-analysis of case control and cohort studies, and they ended up looking at 5 cohort studies with roughly 1.2 million children. Now, this is from 2014, and it has a whole bunch of articles it references. And then I got a text from a former employee of the NIH, I emphasize the former, who says that in early in the President Trump's term, you and colleagues sent 90 papers for review by people at NIH. They felt like the NIH folks felt that without exception, they were severely lacking methodologically, and are found that they indeed showed the safety of these vaccines. We tried to engage Mr. Kennedy, but his colleagues refused to acknowledge the expertise of dozens of NIH scientists we made about those papers. Now, you're a smart guy. You're reading the medical literature, and you're coming up with the recent medical literature on certain issues. But here is both older article, summarizing lots of older articles that have come out since the original refuted Wakefield article in The Lancet regarding measles and autism. And here is somebody who, you know, it's he said, but somebody who said that previously you've had this presented to you. So, back to me. I'm a doc, trying to understand. Convince me that you will become the public health advocate, but not just churn old information so that there's never a conclusion, as Senator Hassan suggested, but that will become the influencer for people to believe, no, there's 1.25 million kids studied and there's no autism associated with measles. You tell me, you see what my question is in there.
Senator, I'm going to be an advocate for strong science. You show me those scientific studies, and you and I can meet about it. And there are other studies as well, and I'd love to show those to you. There's a study that came out last week of 47,000 9-year-olds in the Medicaid system in Florida. I think a Louisiana scientist called Mawson that shows the opposite. So there are other studies out there. I just want to follow the science. And I will do, if the science says that I am wrong about what I've said in the past, as I said, I will publicly apologize. There's many times I've been wrong about science. If you look at my Instagram account, when I'm wrong, I apologize for it. And I say I was wrong. I don't have any problem. Science is a process of challenging hypotheses with new evidence. And scientists have to be able to admit when they're wrong. Epidemiological studies, the Institute of Medicine has said repeatedly in 2013, 2017, when they investigated this, has asked CDC to do certain studies, animal studies, bench studies, observational studies, studies of the vaccine safety data link. CDC has not done that. Oh, I want them to do that, and I want the best science. I can guarantee you, on my word of honor, that if you show me science that says that I'm wrong, I'm going to say I was wrong. I don't have any problem. There's nothing that would make me happier. We need to be able to look at the science and get IOM involved, the National Academy of Sciences. They're the ultimate arbiter of safety.
What was that?
And you know what? One of the things we need to do, I think, is a subject that we haven't talked about here. Why don't we know what's causing this epidemic? Why hasn't the CDC been looking at other hypotheses to determine the etiology of why we've had this dramatic 1,000% increase in this disease that is destroying our kids? Is probably the biggest issue. Why don't we know the answer after 30 years of steady rises in autism rates? Why don't we know the answer to that? We should know the answer.
What was that? What was that last article? Did you mention?
That article is by Mawson, Mawson.
And it's regarding measles and what?
No, it looks at the entire schedule, and it says it's a study of 9-year-old boys, 47,000 9-year-old boys from the Florida healthcare data.
Okay, let me